Hello, world. My name is Daniel Marnie Elkins, and this is Talk About It, a podcast filmed at the Cause Studio at the Bellevue Community Center. Today, I am joined by the one, the only, Miss Yvonne Bunch, who is a legend in Delaware prevention circles. So, Miss Yvonne, for our listeners and viewers, can you tell us a little bit about yourself and your journey in the world of prevention, just to set a context for our conversation?
Yes, I spent my entire 26 years with state government working in prevention in the Department of Services for Children, Youth, and Their Families in the Division of Prevention and Behavioral Health Services. Prior to that, I had the opportunity to work as a community prevention coordinator for the city of Dover. So you're talking 26 years with the state, 5 years with the city of Dover, so 31 plus years working in prevention. I'm not going to talk about my time with the YMCA much, but I worked with Lieutenant Governor Del Wolfe at the time on a campaign called Above the Influence. So I've been doing this prevention work for many, 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 many years, way before we had all this science. I really believe that prevention should be the focal point. It should be at the forefront of any public health crisis, working to prevent or delay the onset of behaviors before they happen. So I have a lot of passion about this work, believe in this work, believe in prevention being a part of children, youth, and families in their communities.
And you mentioned a health crisis, and we are currently in the midst of an epidemic. The opioid epidemic is something that is affecting every single community across this country. I mean, we had 507 Delawareans just last year overdose from opioids. So this is something that we need to talk about. And as a part of that conversation, it is important, I think, to discuss some of the different strategies that the field of prevention and the people working in that field are considering and looking at and beginning to implement. And something that I know you're passionate about is harm reduction. Can you tell our listeners and our viewers a little bit about harm reduction and your thoughts on what role that plays in this overall conversation?
Well, harm reduction is defined as a practical set of strategies to reduce the negative consequences of drug abuse as well as sexual risk factors. I think it's important that when we think of these strategies, that we look at these strategies across a broad spectrum, including safer techniques, managed use, and abstinence. So if we think about our work in the prevention field and how we classify our populations based on level of risk, the Institute of Medicine, if we want to talk about science, where we look at universal, targeted, and indicated, harm reduction fits into that indicated population, where we believe that through some type of treatment or intervention or education, we're able to reduce or minimize that risk to that individual.
And so a harm reduction strategy, a specific example would be like a safe injection site.
Yes.
Okay.
The administering of Narcan.
Okay, so in order to attempt to sort of reverse an overdose. Okay, so do you believe that there is a stigma attached to the use of harm reduction, that in some ways there might be detractors of that practice who say, well, you are just enabling those? What would your sort of viewpoint on that be?
Yes, I think that is the mindset of some of the people. I think by giving Narcan or these safe injection sites, we're not encouraging people to use. We're not saying this is a way we want you to use. We're trying to provide a safer space to use and to offer these strategies as a way to manage the use, but encouraging treatment.
And it's the combination of both is how we can sort of finally find a way through this. So in your years of service, what are some of the innovative practices you've seen here in the state of Delaware that have attempted to sort of address this overall opioid epidemic?
Well, I think the opioid epidemic is somewhat new to Delaware. I think probably within the last several years.
Okay.
But if we look at other issues or other drugs or substances, I think back in the early 90s, under then Governor Carper, when there was major gun violence happening all up and down the state, as well as drugs and crime in high-risk communities. I think one of the things was partnership and collaboration. At that time, there was the Strong Communities Initiative and the work of the Governor's Family Services Cabinet Council. So if you think of the work that's happening now in all these prevention coalitions throughout the state, the same practices that we used back then, we need to employ now, that our coalitions are so familiar with, is bringing different stakeholders together to address the problem.
So you mentioned coalitions, and I know that's something that, at least within the state of Delaware, it's in the last decade or so, there was a transition. So you had these sort of loose groups of people doing prevention, and then a focus has now turned to the formation of coalitions. And I know that's something during your tenure with state government you helped sort of oversee, is taking something like the Delaware prevention and begin to put together the concept that it needs to be a coalition. It was a network, I think there's what they called it before, the DPN, and then it turned into a statewide Delaware Prevention Coalition. And so can you talk a little bit about the experiences of what it was like attempting to unify all the different aspects of prevention throughout the state?
I think if we think about the work of coalitions and their ability to reach large populations and masses with very little money, we know that it's cheaper to put a kid into an after-school program versus putting a kid into a treatment facility or having a kid at Newcastle County Detention Center. So if you think of the work of the coalitions and bringing all those people together versus working in silos, we're able to tackle the problem collectively, utilizing a more comprehensive approach. Treatment needs to be part of that coalition. Enforcement needs to be part of that coalition. Because again, it's all part of creating this comprehensive, integrated service delivery model.
And you hit upon a phrase, silos, working in silos. It's something that I've heard within the field often. Do you believe that these silos still exist, and how can we, as a group, come together to begin to break down those silos and start to partner throughout our communities, our state, and then, the country and, in fact, world as a whole?
I think silos are still here. And I think we just have to keep working at it. And if you think about the importance of coalition, when you bring people around the table, that question that's always on their mind at the forefront, what's in it for me? So we always have to consider that when we're bringing people around the table. And if you think about silos, you're bringing this partner around the table. You're not taking away their vision or their mission or the services that they provide. You gotta look at what piece are we asking that agency or entity to play? I started my work, as I mentioned earlier, working at the local level. I worked for the City of Dover as a community prevention coordinator out of the City of Dover Police Department. Worked very closely with the mayor and a group of community residents and a community advisory board. So as I said earlier, real change happens at the local level. That was municipalities. The City of Dover, along with other municipalities throughout the state. You had Seaford, you had Dover, you had Rehoboth, you had Newcastle County, and you had the city of Wilmington actually involved in prevention work. So that was local level municipalities involved. And so what I think is so important if we're going to continue building a prevention infrastructure, what's the role of these local governments? I know Newcastle County government is taking a stand. They're actively involved in behavioral health. And so I think if you look at the needs of our communities, and the people that are coming into these different communities, I think social services, I think municipalities need to start talking about social services. You cannot ignore what's happening. The pandemic was one thing, but there's other health disparities. There's a homeless population in various cities throughout this state. Is it just the role of state government? Should it just be the role of state government? I would say no. There's a role for local government to take a leadership role, working with social service agencies, working with healthcare providers to address the needs of the communities.
And in doing so, increase the protective factors on a local level, provide wraparound services that can help from from cradle to the grave, as it were, because it is one of those things you have to hit at every level.
Yes.
Right. So it's not just the federal government, it's not just the state government, and it's not just the municipalities. We also need community members and
Yes.
civic organizations to get involved, religious organizations. So in doing so, we can hopefully then unite all people
Yes.
involved in this, because the pieces of the puzzle cannot be solved and put together by any one individual, because it crosses the opioid epidemic and other sort of health disparities that affect populations, are things that are so broad
Yes.
in affecting that you need to come at it from every single angle.
And it requires many voices.
Many voices.
Yes.
United with a unified,
United with the, yes, with the unified.
unified purpose.
Yes. But if you think about the opioid epidemic, the role that the police departments around the Hero Help program,
For those who aren't familiar with the Hero Help program, the Hero Help program exists here in the state of Delaware, and Newcastle County Police Department is something that they put it out there as a resource for people who have experienced addiction, that they can call directly and be working with people who do treatment and then do intervention without any risk to themselves. If they have some background legal issues, they can call. And it's really amazing to see that these police officers are understanding that we cannot enforce our way out of this epidemic, that we have to find other ways. And that's something that I think we've seen at all levels. That is the county government level doing it, but then on a federal level, you've got the Drug Enforcement Administration, which has taken steps to do an educational approach, not a top-down, but a bottom-up. The DEA 360 program has done a lot of work, and we are just approaching here the DA National Take Back Week and Red Ribbon Week and all of these community-based initiatives that they're doing. So thank you for sharing that point. I mean, I think the role of municipalities in this cannot be overlooked. We have to find a way to get them involved.
And another thing, Daniel, I think is also, as we address all these emerging health issues, we have to make sure that we have a prevention prepared workforce. That we provide our workforce with the necessary training and skills to be able to respond effectively to any public health crisis. Right now we're talking COVID and monkeypox and all these other things. So how do we make sure that we have a prepared workforce to respond to the opioid epidemic or any other future health epidemic or health threat or crisis?
At one time, I saw a statistic that said it's 1 out of every 5 opioid overdoses occurs in a public restaurant restroom. And so when you think about how often we as citizens go inside local public restaurants, the fact that not all of us carry Narcan, not all of us have received that training. So that's something that if we as individuals seek that out, and it is being provided throughout the state of Delaware, we can put a link here at the bottom of the screen where you can go and find information about how you can be trained to save a life. Such an important thing.
Yes.
And so in your time at sort of the state government level, you also oversaw the prevention response to the pandemic, the COVID-19 pandemic, which sort of in many ways changed the face of our entire society as a whole, including the field of prevention. Now, you and I have known each other now for several years, and I was working in a capacity of a prevention specialist during that time. And it was interesting to begin to see how organizations and fields chose to respond. So can you just take us back and talk about March of 2020 and what began to happen? Because as the studies are now showing, the pandemic has had an extreme negative effect upon substance abuse. We are seeing a mental health crisis that is beginning to evolve from that. But Delaware is one of the few states that was very adaptive in their approach. So can you talk a little bit about the formation of what is now known as the Delaware Prevention Partners and how that response was crafted?
I think one of the things, Daniel, as prevention professionals and preventionists, we must be flexible. Mm-hmm. And we have to adapt to changing situations and landscapes. Mm-hmm. So when the pandemic hit, most of our providers were providing services in a face-to-face, going into a building. Mm. So we had to make that shift and move to a virtual space. Mm-hmm. It was challenging for some of our providers to do that. I think if we sit back and we think about how it all happened, money was tied to it, because it was federal dollars. How do we justify paying staff and keeping staff employed that were basically used to providing services in a building? So out of that, we formed the Delaware Prevention Partners, where we had to think outside the box. Mm-hmm. We had to think about how do we still maintain the requirements of the federal dollars and still provide these services in a virtual space. Mm-hmm. So we formed the Delaware Prevention Partners. They started meeting monthly. We looked at bylaws. We started having different types of group activities, public service announcement, TikToks. You were involved, thanks to your effort and the efforts of the cause. Mm-hmm. I mean, doing things, thinking outside of the box. Mm-hmm. And now, we're still in this, what some people want to say, a post-pandemic, but we still have to stay in that virtual space. Mm-hmm. I think one of the things with the pandemic, it showed us that we had to meet the needs of our youth and families in a different way. Social media played a very important role. Mm-hmm.
And in a world in which, as you said, the field of prevention, a lot of it was based around not only just face-to-face, but it was face-to-face delivery of evidence-based curriculum in a school setting. Mm-hmm. So what happens when the school closes? How do you begin to then have the connections in the community with the families to be able to, talk about the need to address all of these problems? And I know that's something that you sort of helped lead and have always been someone who has been a big supporter of involving youth directly in the work of prevention itself. And so one of the very first events that I attended as a brand new resident to the state of Delaware, someone who was just beginning their career in the field of prevention, was the Teen Summit. Can you talk a little bit about the history of that, and then, if you could, the importance of involving youth being the ones who are actually giving the message and putting it in their own words?
Yes, if I think about the Teen Summit, I think it was sometime in 2000. We again, the beauty of partnerships and
Mm-hmm.
collaboration. You had Duffy's Hope doing the softball game. You had AIDS Delaware doing the Teen Idol.
Mm-hmm.
So at the time, I approached both groups, Duffy Hope and AIDS Delaware. Let's do this Teen Summit,
Mm-hmm.
and we met through collaboration and partnership and birthed this thing called Hollywood Invades Delaware.
Mm-hmm.
And so the first Teen Summit had over 1,000 kids. Hill
Mm.
Harper at that time was our keynote speaker. And then we spent evenings and weeknights working with kids, making sure that the workshops were led by kids,
Mm-hmm.
facilitated by kids, getting kids involved, talking to their peers about issues that impact them on a daily basis. And if you think about some of the signs, I always feel like I have to incorporate signs in here. If you look at the efforts of the system of care model, youth-led, family-driven.
Mm.
If we think about case planning and our casework, making sure that the families involved, the client has a voice. And if you think about treatment, making sure that our interventions and modalities are patient-centered. So you have to think about all of this, whether you're doing prevention work, treatment work, case management, making sure that that client, that patient has a voice.
Mm. And these strategies that you are talking about are not just strategies that can be used to address the opioid epidemic. It can be used to address any problem within the community surrounding substance abuse or mental health or violence. And that's something that's always sort of fascinated me is how do you create sustainable work within this field? And I just want to take a moment because you said in 2000, so 22 years ago, that you began the process of working with the Duffy's Hope and then AIDS Delaware. And for the listeners and viewers, an interesting and sort of neat fact, the 2022 Teen Idol was actually held right here on this stage. 22 years later, the work is still continuing. We took youth to Duffy's Hope Celebrity Basketball game this year. So to me, it's the establishment of these sustainable sort of ventures that are helping empower youth. If you could have one legacy in this field, what would it be?
I think, well, let me go back. I think with the Delaware Invades Hollywood, it was probably like maybe, I don't know, 7 or 8 years ago, somewhere
Mm-hmm.
around that time. Yeah. But as far as like youth conferences, it's something that we've been doing for some time.
Yeah.
And I would say probably dated back to 2019 or the late 1990s.
Mm-hmm.
I remember working very closely with the guidance counselors in the various school districts where they bus kids to Delaware State College at the time during the day for a youth conference. So again, it's that partnership and collaboration that's so key. I think one of the things, Daniel, that's challenging and that's going to be a challenge for prevention is administrations come and go.
Mm.
Leadership changes happen, and I always say that real prevention happens at the local level, because you're going to always have state and federal administrators and leaderships that they're going to change. So how do we ensure that we build a prevention infrastructure at the local level that's able to stand the test of time amidst all these changes in administrations? Right now, you think about next couple of years, we're going to be looking to elect a new governor.
That's right.
Changes, who knows what's going to happen in D.C.
Right.
So we have to make sure that at the local level that the prevention infrastructure is strong enough to sustain those changes, and that their voice, and that their voice is strong enough.
and that something that you have always advocated for, especially when people who are involved in the field of prevention from the state of Delaware are attending the Community Anti-Drug Coalitions of America conference, is that we speak not just with a strong voice, but with a unified
Yes.
voice. Yeah. So what's next for you? What are you working on? Is there anything coming up that you are starting to plan for the state of Delaware surrounding prevention?
I'm working very closely with the Delaware Prevention Partners and the Lieutenant Governor's Office on a Youth Prevention Day.
Okay.
That's part of the National Prevention Network Week in May.
Okay.
So that's
Excellent.
an exciting event for us where youth throughout the state would gather and meet with key legislators and talk about issues that impact youth on a daily basis: mental health, substance use, opioid use.
Well, you heard about it here first. So mark your calendars. National Prevention Week in May. We will have a prevention day here in the state of Delaware, and it sounds like that's something that they're going to talk about, and we can talk about it. So thank you very much for coming and being our guest today. This is Talk About It. Stay tuned to our next episode coming soon. Thank you so much, Yvonne.
Thank you.